What happens when you get infected? There are many types of coronaviruses. Some give you the common cold. The new coronavirus behind the 2019 to 2021 pandemic causes an illness called Covid-19. How does coronavirus attack your body? A virus infects your body by entering healthy cells. There, the invader makes copies of itself and multiplies throughout your body. The new coronavirus latches its spiky surface proteins to receptors on healthy cells, especially those in your lungs. Specifically, the viral proteins bust into cells through ACE2 receptors. Once inside, the coronavirus hijacks healthy cells and takes command. Eventually, it kills some of the healthy cells. How does coronavirus move through your body? Covid-19, the illness caused by the coronavirus, starts with droplets from an infected person's cough, sneeze, or breath. They could be in the air or on a surface that you touch before touching your eyes, nose, or mouth. That gives the virus a passage to the mucous membranes in your throat. Within 2 to 14 days, your immune system may respond with symptoms including fever, a cough, shortness of breath or trouble breathing, fatigue, chills, sometimes with shaking, body aches, headache, a sore throat, congestion or a runny nose, loss of taste, loss of smell, nausea or vomiting, diarrhea. The virus moves down your respiratory tract. That's the airway that includes your mouth, nose, throat, and lungs. Your lower airways have more ACE2 receptors than the rest of your respiratory tract. So COVID-19 is more likely to go deeper than viruses like the common cold. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia, an infection of the tiny air sacs, called alveoli, inside your lungs where your blood exchanges oxygen and carbon dioxide. If your doctor does a CT scan of your chest, they'll probably see shadows or patchy areas called ground glass opacity. For most people, the symptoms end with a cough and a fever. More than 8 in 10 cases are mild. But for some, the infection gets more severe. About 5 to 8 days after symptoms begin, they have shortness of breath, known as dyspnea. Acute respiratory distress syndrome, ARDS, begins a few days later. ARDS can cause rapid breathing, a fast heart rate, dizziness, and sweating. It damages the tissues and blood vessels in your alveoli, causing debris to collect inside them. This makes it harder or even impossible for you to breathe. Many people who get ARDS need help breathing from a machine called a ventilator. As fluid collects in your lungs, they carry less oxygen to your blood. That means your blood may not supply your organs with enough oxygen to survive. This can cause your kidneys, lungs, and liver to shut down and stop working. Not everyone who has COVID-19 has these serious complications. And not everyone needs medical care. But if your symptoms include trouble breathing, get help right away. If you are new to my channel or if you haven't already, make sure you click that subscribe button. I would really appreciate it. Life is too short to be negative, so make sure you're keeping it positive.